Peripheral neuropathy is a common condition occurring when injury or disease damages your peripheral nervous system. Originating from your brain and spinal cord, peripheral nerves extend to your skin, muscle, and tissues. Your peripheral nervous system relays vital information between your body and the brain in the form of electrical impulses. There are 3 types of peripheral nerves. Motor nerves regulate the movements of your body's skeletal muscles. Sensory nerves transmit sensations such as heat, vibration, touch, and pain to the brain. Autonomic nerves regulate the activities of internal organs and glands. Each nerve is made up of many interconnected cells, called neurons, that transmit impulses at lightning speed. This constant exchange allows your brain to respond to vital input from your body. However, damage to the nerves disrupts this critical link, resulting in peripheral neuropathy. Damage to a single nerve, called mononeuropathy, usually results from injury or repetitive stress. An example of mononeuropathy is carpal tunnel syndrome. Repeated impact to the nerve in your wrist may cause tingling, pain, and weakness in your hand, arm, and shoulder. Involvement of multiple nerves, called polyneuropathy, is far more common. Damage typically begins in the nerves farthest from the central nervous system and progresses symmetrically. Polyneuropathy can be caused by diabetes and other systemic diseases, infections, or exposure to toxic substances. One or all of the 3 nerve types may be affected, and symptoms are specific to each. Damage to sensory nerves, characteristic of diabetes, can lead to numbness in your hands and feet, with diminished ability to detect temperature, insensitivity to pain, or oversensitivity to pain. Polyneuropathy may also cause damage to your motor nerves, which can result in muscle weakness, twitching, and pain. Common signs of autonomic nerve damage include intolerance to heat, loss of bladder control, gastrointestinal disturbances, impairment of breathing, and impairment of heart rate. Generally, treatment of peripheral neuropathy is aimed at treating the underlying cause and providing symptomatic relief. If you have mononeuropathy, you may receive pain relief medications, physical therapy to maintain muscle strength, or surgery to release compressed or entrapped nerves. If you have polyneuropathy, your doctor will treat the underlying disease to prevent further damage to the nerves. He or she may recommend pain medication to relieve your symptoms. If you have polyneuropathy with sensory impairment, your doctor may recommend orthopedic shoes to prevent foot injury.
Hi, I'm Dr. Steve Edelman with today's diabetes question. I have been diagnosed with diabetic peripheral neuropathy. Can I still exercise? Peripheral neuropathy is a condition that can lead to loss of sensation in the feet and occasionally the hands. Exercise is important for everyone. However, you should consider swimming or riding a stationary bike to minimize the impact on your feet. Now remember, don't stop moving. Low-impact exercise, including walking, may help relieve symptoms. Always protect your feet with athletic shoes with silica gel or air midsoles, as well as good cotton socks. And remember, check your feet daily. I'm Dr. Steve Edelman.
All right, well, if you have neuropathy, then you should know that you do not have to suffer any longer in silence. And joining us right now is Dr. Michael Temple. Thank you for joining us. And, oh, here, where am I talking to? Where are we? Where are we here? Over here. And also we have Dr. Sartz, and we have Dr. Temple, and we have Sherry, who is our patient. And I guess let's start with you first. Word has it that you are soon going to be going into your 4th year of providing effective relief for people who have been suffering from peripheral neuropathy. Now, to me, I'm thinking neuropathy, peripheral. Give us the explanation, tell us the scoop, and give us the rundown.
Well, basically, peripheral neuropathy is dealing with kind of a very difficult thing to diagnose. It's misunderstood a lot because most people associate it just with diabetics. Yet 70% of the people that suffer with peripheral neuropathy are not diabetic. There are over 100 known different causes for neuropathy.
Sherry, what about you? Is this something that are you diabetic?
Yes.
Yeah. So there we go. But many people do not.
Many people are not. The thing is that because of the fact they always assume that somebody is diabetic, but it can manifest itself in a number of different ways. Generally, it'll start in the feet with a change in sensation, and that change can be anything from numbness or tingling to just a total loss of sensation to becoming very painful. They may feel like they're freezing. They may feel like they're burning.
This is my husband, you guys. Type 2 diabetic, having all kinds of problems.
Right.
I mean,
and that's exactly what we're dealing with. And so and what we're actually dealing with is that we're actually able to get to the point where we can develop these nerves back up.
No, it's fantastic, and I know that. Tell us a little bit about other doctors and clinics. They've actually given up. I mean, they've been trying to address this issue for the problem. What is your secret? What is it that you guys do that's special and that has helped so many patients?
Well, Debbie, the secret is that we actually have 3 things that we do that nobody else does. The first thing has to do with the laser itself. You've got to have the right wavelengths, you've got to have the right spacing of the diodes, and you've got to have the right length of time that you're actually treating them, because if you screw that up, it will actually shut down the system and it won't work as well. Number 2, you have to, once the nerves begin to show response, you have to improve their potentiation. And we have methods where we do some stuff in office that will help improve the nerve activity.
Wow.
And we teach the patient things to do at home. And it takes a little bit of time, but oh my gosh, it's so much worth it.
And have you suffered with this yourself?
I did have neuropathy following surgery, and did all kinds of really neat things that didn't work.
Yep.
And then the darn laser helped me, and I kind of got all involved with that, and I've been doing it for 8 years now.
Wow. And so so the laser is actually literally just, and I'm trying to describe it. Just give me a little description so we can kind of get a description.
Basically what we're doing is that we actually have a boot that it'll actually encompass the entire foot, so that we can leave it for a period of time. That it's a little bit different than some of the things that Sherry has gone through a number of different things, so trying various different treatments, and basically came into our office extremely skeptical about being able to help, and she can describe.
Yeah,
Yes.
tell us a little bit.
Well, I went through several things. I even did acupuncture. I did the anodyne, which didn't work. I tried all kinds of things, and so my husband and my daughter saw this ad in the paper.
Wow.
And they said, well,
I
why
remember
don't you
reading
try
actually
it?
about it myself.
Yeah. And I thought, but I decided, okay, I'll go talk to him. So I talked to him and everything, and then I was going to take a trip, so I went up and saw my son and my daughter-in-law and family, and they were
impressed.
And
you just completed your treatment not pretty recently?
Just about 7 weeks ago.
And you're doing great.
Yeah.
I'm thrilled to hear
Yes,
that.
I am. I'm proud of it.
Give us a little of a bit of an idea of how life has changed for you since treatment, since these guys have made a difference in your life.
My daughter was the one that noticed it first, because I can go up and down the stairs easier with her and everything. I walk a lot. I walk with my grandkids. I have a ball with them, and and my husband noticed it then, because I move a lot easier. I don't have as many problems. It's just great.
That's fantastic news.
Yes.
I'm thrilled to hear you guys. I have to talk to my husband about this. I think he needs you guys.
It's amazing how many people have said, Doc, thank you for giving me my husband back. Thank you for giving me my wife back.
Oh, tell us about the special offer quickly.
Special offer is normally when we take a patient in, we have to make, number one, that they qualify, that what they have is something we can help them with. We do a complete analysis. We do a complete protocol development. We do the testing, and normally it's $195, and we're going to offer anybody that says, Debbie sent me, an 80% discount. So we'll do all that for $39.
Unbelievable. Dr. Temple, Dr. Sartz, and Sherry, thank you guys all so much for being here. And, really just need to give a little bit of information about this. The Neuropathy Center's offices are in Chandler, correct? Scottsdale and Peoria. And you can find out more. You can call the toll-free number. It's 1-800-991-6783. Thanks again for all the great work you're doing.
I see a lot of diabetic patients in my practice and have been frustrated with my inability to manage their neuropathy. Many of them come to me taking many medications, and they're not happy patients, and they have a lot of pain. About a year ago, I started dispensing Neuremedy to my patients. It's a nutritional supplement used to manage their neuropathy, and have been very pleased with the outcomes. I'd say about 50% of my patients have improved with the use of Neuremedy, and I'll continue using it. I've had one patient in particular that could not sleep through the night. After taking Neuremedy for 2 months, the patient is much more comfortable, sleeps through the night, and is a very happy patient.
Peripheral neuropathy is due to damage of the nerves, and it causes all kind of symptoms, and they vary from patient to patient, but the most common symptoms are pain, numbness, burning, tingling, and the opposite feeling, ice-cold feet. Now, there are many, many causes of peripheral neuropathy. Diabetes is one of the first causes that come to mind. Other causes are chemotherapy agents can damage the nerves. Certain medications such as antibiotics or other medications such as cholesterol medication, which has a chemical in it called statins, and the statins have been shown to be linked to peripheral neuropathy. Now, that's not to say you should stop taking your cholesterol medication, because it's very important that will control stroke and heart attack, but it can be a contributing cause of peripheral neuropathy. It can be an inherited condition. Other causes are exposure to chemicals and toxins. In the old days, when paint had lead in them, we saw higher incidences of peripheral neuropathy. I've seen veterans coming back from the Vietnamese War who were exposed to Agent Orange. So a lot of problems can be caused from exposure to certain chemicals and toxins. Certain nutritional deficiencies, such as vitamin B12 deficiency, can cause peripheral neuropathy. Surprisingly, over 50% of the people who have peripheral neuropathy, we don't know the exact cause, and that's called idiopathic neuropathy. Okay. Peripheral neuropathy usually requires many different types of treatments. There's no one magic bullet that can treat peripheral neuropathy, so we use a wide variety of approaches. One of the treatments that we use is, or has been used traditionally, has been the stronger prescription medications, which I do use on occasion, but they can have some side effects. So more conservative treatments would be a nutritional or more holistic or natural approach, and that would be the use of vitamins and nutritional supplements to help neuropathy. Also, topical creams. In some instances, people experience burning of the feet, and there are creams that can help cool the feet down. People have the opposite feeling where their feet are ice cold, and there are certain topical creams that can actually warm the feet up. Also, there are some therapies that can be helpful as well. Laser therapy and infrared therapy have been quite effective in many cases in reducing discomfort of peripheral neuropathy.
Dr. Joe here, talking about an observational study of the effect of metformin on vitamin B12 status and peripheral neuropathy. That's a big mouthful, and here it is. But the interesting thing is that this has been discussed, maybe 20 years, and this has been something that nobody can find out anything to worry about, except there is a little diminished amount of B12 in the blood, the more metformin and the longer you take it. So this is something that is come from the British Journal of Diabetes and Vascular Disease, and has a number of references and really a good period of things. So if anybody has a problem with numb feet or anything like this, the B12 and folate levels should be measured, and the consideration of whether or not you have vitamin B12 lower than should be taken into consideration. This has been a long-standing controversy, and it isn't done. They're not saying that everybody should stop metformin, just to check it out. So it's your time.